My name's Dr. Peter NGUNGI NJUKI. I work here in Nanjokwe Hospital. It's mainly, most of the hospital is a public hospital, but I also do limited private practice. Like the office where I'm sitting now is where I do limited private practice. Yeah, I did a course with the Merck Foundation on acute medical care, and which was quite a useful course for the work which I do. Because mainly when I'm working, I deal with primary health care, where patients with the different kind of conditions present. And also I deal with the emergency care. So the course offered a good background from both primary care and secondary care. Also, I do a bit of a lot of administrative work, and the course was also very useful for me as a supervisor in the departments of family medicine and the emergency care department. Now, this course was offered online, and it was quite involving and engaging. It was really requiring a lot of hours per day, per week, not less than 10 hours. But the course content was very, very appropriate for the type of environment where I am providing care. Most of the modules and what I face on a daily basis, if not weekly basis, if not so daily basis. And some of the modules which were very, very, very useful were some of the modules like the modules on diabetes, high blood pressures, and endocrinology, and most of them were very, very, very useful. And the staff members which were giving us these courses were really very excellent. Their modes of study was also very good, very engaging, where questions were being posted in the whiteboard, and then students contribute to the answers, and then we discuss those answers, and then the lecturers gives us feedbacks. So they were really very, very, very good, and they were engaging very well. The examinations were also very nice, and also the assignments, the individual assignments, the group assignments were also very, very high standard of things. Yeah. So after finishing the course, one of the things I could say is that I have tried to integrate what I've learned with especially the supervision part, because I supervise medical officers who are under me and the interns. So I have tried to integrate a lot of it into my supervision role. And when we are discussing issues, maybe it's a diabetic care, or it's care of a patient with arthritis, or any other issue which we are discussing, I feel I am very much more empowered to provide an opinion, an evidence-based opinion on the way forward in those situations and circumstances. The other thing which I have tried to do, we have tried to establish some clinics which we are still in the early stages. One of them is a diabetic clinic, which we have been trying to negotiate with some donors to help us to overcome some bottlenecks. And then the other issue is the issue of advocacy, because the patients, sometimes they don't get what they didn't deserve, but we are able to participate more effectively out of that training about on advocacy and advocating for the needs of our patients. For me personally, I feel more empowered because some of the things after medical school, we know we read books, but after you read a book, you read maybe one chapter to cross-check what you have been doing as a doctor, to see maybe this patient you are treating and diabetes and you want to cross-check, we check for 1 minute and you satisfied. But now with the course, you feel you have understood much more, not only about the treatment for that patient, but the overall way of treating, even patients like maybe is a pulmonary embolism or a cardiac problem. The training kind of empowers you to in-depth analysis of a patient and management of that patient. So this has been, that's the way I can say the training has impacted me on a personal level. So I feel I have better as a doctor, I'm better as a supervisor, even as a community member. I am much better. One of the things which also was part of this training was reflections, and as a person you also learn how to reflect on what you do and how you do it and when you do it and where you do it. So it becomes very hard tool as a professional to have it. On the question of whether I can refer someone else, I would say first of all I can refer myself because there are some other courses which I would like to do. I know I am already doing a master's program, a master's program with the university. But there are other modules which I would like to participate in, maybe a specific module on diabetes, a specific module on psychiatry, and I have recommended that they also include a module on anesthesia. So if these modules are going to continue being available, I can refer myself. So I have that confidence myself, I can take another course. And I have referred actually many people to this course. I have referred them to the course already. They are just waiting for the intake, and I believe I will continue to do that. So maybe finally, what I would say, I'm actually very grateful for Merck Foundation to make these courses available. Most of the time, we don't have finances in the government to sponsor such trainings, but Merck Foundation has found the resources to sponsor people. So I'm very grateful to Merck Foundation and even to the lecturers who are providing this online training. So I'm very thankful. Thank you.